Like the rest of the world, all of us at WHO have been shocked, appalled, and saddened by the conflict in Israel and Gaza. The attacks by Hamas and other armed groups on the 7th of October that targeted Israeli civilians were horrific and unjustifiable. At the same time, WHO is gravely concerned about the health and well-being of civilians in Gaza who are suffering from bombardment and siege. I also deplore the attacks on healthcare in both Gaza and Israel, which have led to deaths and injuries of health workers and patients on both sides. Under international humanitarian law, all armed actors are obliged to actively protect healthcare. The bomb that struck the Al-Ahli hospital in Gaza City on Tuesday night and the loss of life it caused, regardless of who was responsible, cannot be tolerated. Despite the airstrikes and the risks to their own security, the WHO team in Gaza has delivered life-saving medical supplies sufficient to care for 2,000 patients, but much more is needed. We welcome Israel's announcement yesterday that it will not block the entry of water, food, and medicines into Gaza from Egypt. Fuel is also needed for hospital generators, ambulances, and desalination plants, and we urge Israel to add fuel to the life-saving supplies allowed to enter Gaza.
We are ready. We will be ready to cross the border with the trucks, 5 truckloads of medical supplies as soon as the border is open. That's really what's most important. Whenever that border becomes open, we will be there. And as of today, we have received confirmation that our supplies are indeed loaded in trucks and ready to join the convoy to cross the border.
It's not just crossing the border at Rafah. And anyone who's ever worked in a humanitarian setting knows that there's a long way to go in terms of getting to a hospital facility or getting to a frontline health centre. The roads are very badly destroyed. There's a huge issue of deconflicting those routes so that the trucks that carry that material are not attacked in any way or disrupted in any way, and that the goods can be offloaded safely and then put into further storage for further distribution. There are absolutely no guarantees in the humanitarian situation that you can completely avoid any diversion of aid. Aid diversion is a fact. It happens. We do everything in our power to ensure that that doesn't happen. Humanitarian assistance needs to move every day. 2.5 million people need assistance. 20 trucks is a drop in the ocean of need right now in Gaza. One of the biggest needs has been blood bags. The people of Gaza historically are brilliant. They've always been able to donate enough blood. And it's the same in every conflict. Very often it's not a lack of blood donors, it's a lack of a safe way to take and give blood. So you run out of blood bags before you run out of blood. That's usually, I mean, it sounds crazy, doesn't it?
But one of the most critical items which need to be added to that convoy is fuel. Fuel to make sure these desalination plants can run. Fuel to make sure these bakeries can run. Fuel to make sure that UN partners can actually implement the most essential operations, and fuel to ensure these hospitals can sustain their operations and can sustain lives. So fuel is absolutely a top priority. Almost 3,500 people have been killed in Gaza, of which I just want to say almost more than half are women and children. Over 12,000 Gazans have been injured. Again, close to half are women and children. In the West Bank, we talk about 62 Palestinian killed and 1,300 injured.
The numbers that we have from Israel is 1,400 dead and 3,500 injured, many still recovering, still in the hospital. WHO offered solidarity, presence, and support, and I visited directly affected areas. I visited affected hospitals. I visited the morgues and the National Forensic Institutes. I listened to the patients. I listened to the survivors. I grieved the dead. what Israel is facing is a singular event. The mental health needs are immense and they are scaling up by the days. Those emergency mental health needs must be addressed very quickly. And I must say that bearing witness and offering solidarity support is a key function here, and it does have an impact. So the situation is a situation of a trauma, a massive trauma.
There is still time and opportunity to prevent the situation from escalating further. WHO supports the United Nations Secretary General's call for an immediate humanitarian ceasefire. We call for the immediate and safe release of hostages seized and taken into Gaza by Hamas and other armed groups, among them children, older people, and those who need urgent medical care. We continue to appeal to Israel and Hamas to abide by their obligations under international law to protect civilians and healthcare. We appeal to Israel to restore supplies of electricity and water. I wish to be clear that, as a United Nations agency, WHO is politically impartial and is committed to supporting the health and well-being of all Israelis and all Palestinians. While the crisis in Israel and Gaza is understandably dominating our headlines, there is another crisis that's being forgotten: Sudan. 6 months after the start of the fighting, the conflict in Sudan has had a devastating impact on people's lives and health across the country and beyond its borders. More than 5.8 million people have been forced to flee their homes within and outside Sudan. Sudan's health system was already overstretched before the war. Now it's at breaking point. About 70% of hospitals in conflict-affected states are not functional. People are dying from a lack of access to basic and essential health care and medication. The rainy season in Sudan is further limiting access to vulnerable communities. A cholera outbreak is spreading rapidly, while other outbreaks of malaria, measles, and dengue continue to take lives. We need the international community to show solidarity now. We need the steadfast commitment and support of our donors to continue to strengthen the response and meet the ever-mounting needs of the people of Sudan. But the solution to this crisis is not fundamentally a humanitarian solution. It is a political solution. The influenza season is approaching in the Northern Hemisphere, even as hospitalizations and deaths from COVID-19 continue to increase. To protect yourself and your loved ones, and to help take the strain of health systems, WHO recommends vaccination against both influenza and COVID-19, especially for high-risk groups.
Right now, the dominant variant worldwide is EG.5, which is on the increase, and about 48% of sequences that are submitted globally are this particular variant of interest. And there are a number of variants around the world that are in circulation. So while COVID is only one one disease that we are dealing with, it is one that is still circulating in every country. And right now we are seeing an increase in percent positivity for SARS-CoV-2 in the last several weeks. And this is the head of the Northern Hemisphere winter season. And it's really critical that those who are most at risk get vaccinated for COVID, get that additional dose when it is time for you, because those doses of vaccine prevent against severe disease and death.